My name is Brianna Osborne, and I am doing my presentation on schizophrenia. Schizophrenia is a chronic, disabling, and severe brain disorder that affects about 1% of Americans. It is known to be a long-lasting psychotic disorder in which there is an inability to distinguish what is real and what is a fantasy, as well as disturbances in thinking, emotions, behavior, and perception. Schizophrenia was once known as dementia praecox, meaning out of one's mind before one's time. Later renamed to schizophrenia by the Swiss psychiatrist Eugen Bleuler. Schizophrenia typically appears when a person is in his or her teens to early 20s. Schizophrenia is in the top 10 causes of disability in developed countries, and there is no cure, but it is highly treatable. Scientists have stated that there are many causes of schizophrenia, but genetics, environmental factors, and brain chemistry are the three main causes of schizophrenia. The first cause is genetics. Schizophrenia tends to run in families. 1% of the general population has this illness, but it occurs in 10% of people who have a first-degree relative with the disorder, such as a parent or a sibling. The risk is highest for an identical twin of a person with schizophrenia, and diazotic twins in a child with one parent with schizophrenia have a 17% risk of getting the disorder. The second cause of schizophrenia is environmental factors. Scientists think that interactions between genes and the environment are part of the development of schizophrenia. Examples would be exposure to viruses, problems during birth, heavy adolescent marijuana use, and other not yet known psychosocial factors. There are 5 subtypes of schizophrenia. The first subtype is paranoid schizophrenia, which is when a person has delusions or false beliefs that someone is coming to get them or their family. Paranoid schizophrenia is known to be the most common among people who have schizophrenia, and they are always thinking of ways to protect themselves. The second subtype of schizophrenia is catatonic schizophrenia, which is when a person is mute and withdrawn, negative, and often assumes very unusual body positions. Catatonic schizophrenia is rare. The third subtype is residual schizophrenia, which is when a person is no longer experiencing delusions or hallucinations but has no motivation or interest in life. Residual schizophrenia is considered the least severe and the least debilitating of all. The fourth subtype is disorganized schizophrenia, which is when a person is often incoherent in speech and thought but may not have delusions. Disorganized schizophrenia is said to be a more severe type because the person cannot perform daily activities. Last but not least, the fifth type is undifferentiated schizophrenia. Undifferentiated schizophrenia is when a person has symptoms of schizophrenia but they are not sufficiently formed to permit classification of the illness into one of the other subtypes. Undifferentiated schizophrenia is challenging to diagnose, and it can take weeks or months to confirm a diagnosis. The symptoms of schizophrenia are put into 3 categories. The categories are positive, negative, and cognitive symptoms. Positive symptoms appear to reflect an excess or distortion of normal functions. Examples would be delusions and hallucinations. Negative symptoms appear to reflect a decrease of normal functions such as social withdrawal and emotional unresponsiveness. Cognitive symptoms are very subtle and difficult to recognize, such as trouble paying attention and poor executive functioning. In conclusion, schizophrenia is a chronic, disabling, and severe brain disorder that is known to be a long-lasting psychotic disorder in which there is an inability to distinguish what is real and what is a fantasy, as well as disturbances in thinking, emotions, behavior, and perception. The causes of schizophrenia are genetics, environmental factors, and brain chemistry. The 5 subtypes of schizophrenia known as paranoid schizophrenia, catatonic schizophrenia, residual schizophrenia, disorganized schizophrenia, and undifferentiated schizophrenia. The symptoms of schizophrenia are categorized into 3 categories: positive symptoms, negative symptoms, and cognitive symptoms.